Bienvenue à cette conférence de presse. My name is Guillaume Saint-Pierre. I'll be your moderator. So joining us today, Dr. Theresa Tam, Chief Public Health Officer, and Dr. Howard Njoo, Deputy Chief Public Health Officer. So we will start with remarks and then go to questions. We have until noon. Dr. Tam, go ahead.
Merci, thank you. Bonjour à toutes et à tous. Following several weeks of declining activity nationally, the average daily case counts are now leveling off, with continued regional variability across the country. As public health measures ease, increased levels of transmission are not unexpected, since the SARS-CoV-2 virus is still circulating widely. Severe illness trends are still declining nationally and in most jurisdictions, with the average daily numbers of people with COVID-19 in hospitals and in intensive care units in the past week having declined by 11% and 14% respectively compared to the week prior. As we expect the SARS-CoV-2 virus to continuously evolve, we're closely monitoring the domestic and international situation and preparing for new variants. The BA.2 sublineage of the Omicron variant is increasing in Canada, but at a slow rate, while other sublineages are declining or stable. The growth rate of BA.2 internationally appears to be highest where there is a combination of low booster coverage and where BA.1 has not already driven high infection rates. While evidence suggests BA.2 is more transmissible than BA.1, BA.2 does not appear to be associated with more severe illness in vaccinated populations. However, it is still capable of causing severe disease among people without prior immunity, which underscores the importance of getting up to date with COVID-19 vaccines, including a booster if you're eligible. Over the past 2 years, Canadians have shown tremendous capacity to adapt to change and uncertainty as the pandemic has evolved. While COVID-19 is here to stay, we are now entering a period with more opportunities for in-person activities, gatherings, or travel. Some of us may be feeling a greater sense of comfort, while others may feel less at ease. Many people in Canada may be taking into consideration factors such as COVID-19 vaccination status, the level of COVID-19 activity locally, underlying medical conditions, and risk to personal contacts to make informed decisions. This includes choosing activities that are best for their individual and family situation and using personal protections. For example, to continue wearing a well-constructed, well-fitting mask as an important added layer of protection, even if not required by local authorities. We know that these proven practices, along with strong protection afforded by being up to date with your COVID-19 vaccines, have reduced the impact and severity of the pandemic. I encourage Canadians to show each other compassion and respect as we make decisions to protect ourselves, our families, and our communities, especially those at highest risk. These times of transition can be challenging and stressful to navigate. If you are having a difficult time, know that you're not alone and help is available. Resources such as Wellness Together Canada provide people in Canada of all ages 24 hours a day, 7 days a week, with immediate, free, and confidential mental health and substance use supports, including information and practical tools and confidential sessions with social workers, psychologists, and other professionals. Pocket Well, a free companion app to the Wellness Together Canada online portal, provides another way to access online resources and to measure and monitor aspects of your well-being. Indigenous peoples can also contact the toll-free Hope for Wellness helpline. COVID-19 continues to challenge us and impacts us differently, depending on our circumstances. So let's continue to do what we can to support one another as we navigate the road ahead. Thank you. Merci. Megwich.
Bonjour à toutes et à tous. Après plusieurs semaines d'une tendance à la baisse de l'activité à l'échelle nationale, le nombre moyen des cas quotidiens se stabilise et la variabilité régionale se maintient au pays. Au moment où les mesures de santé publique sont assouplies, des niveaux accrus de transmission ne sont pas inattendus car le virus de SARS-CoV-2 demeure largement répandu. Les tendances relatives aux cas graves sont toujours en baisse à l'échelle nationale et dans la plupart des provinces et territoires. Au cours de la dernière semaine, le nombre moyen quotidien de personnes atteintes de la COVID-19 dans les hôpitaux et les unités de soins intensifs a diminué de 11 et 14 % respectivement par rapport à la semaine précédente. Comme nous nous attendons à ce que le virus de SARS-CoV-2 évolue constamment, nous surveillons de près la situation au pays et à l'étranger et nous nous préparons à l'apparition des nouveaux variants. Le nombre de cas de sous-variant BA2 du variant Omicron augmente au Canada, mais à un rythme lent, alors que les nombres de cas des autres sous-variants sont stables ou en déclin. À l'échelle internationale, le taux de croissance de sous-variant BA2 semble être le plus élevé où il y a une combinaison de facteurs suivants. Le recours aux doses de rappel est faible et le sous-variant BA1 n'a pas encore provoqué des taux d'infection élevés. Bien que les données probantes indiquent que le sous-variant BA2 est plus transmissible que BA1, BA2 ne semble pas associé à une maladie plus grave dans les populations vaccinées. Toutefois, ce sous-variant risque tout de même de rendre gravement malades les personnes sans immunité antérieure, ce qui souligne l'importance de recevoir toutes les doses de vaccins contre la COVID-19, y compris un rappel si vous y êtes admissible. Au cours des 2 dernières années, les Canadiens ont démontré une capacité exceptionnelle à s'adapter aux changements et à l'incertitude au fur et à mesure de l'évolution de la pandémie. La COVID-19 est là pour de bon, mais nous amorçons une période où les possibilités d'activités en personne, de rassemblements et de voyages seront plus nombreuses, ce qui procurera à certains d'entre nous peuvent se sentir plus à l'aise, tandis que d'autres peuvent se sentir moins à l'aise. Pour prendre des décisions éclairées, de nombreuses personnes au Canada peuvent tenir compte de différents facteurs comme le statut de vaccination contre la COVID-19, le niveau d'activité de la COVID-19 à l'échelle locale, les problèmes médicaux sous-jacents et le risque pour ceux et celles qui font partie de leurs contacts étroits. Il est notamment question de choisir les activités qui conviennent le mieux à leur situation personnelle et familiale et de prendre des mesures de protection personnelle, par exemple, de continuer à porter un masque bien conçu et bien ajusté comme protection supplémentaire importante, même dans les cas où les autorités locales ne l'exigent pas. Nous savons que ces pratiques éprouvées, combinées à la solide protection d'une vaccination à jour contre la COVID-19, ont atténué les effets et la gravité de la pandémie. J'encourage les Canadiens à faire preuve de compassion et de respect les uns envers les autres au fur et à mesure que nous prenons des décisions pour assurer notre protection et celle de nos familles et communautés, en particulier des personnes les plus à risque. Il peut être difficile et stressant de traverser ces périodes de transition. Si vous vivez les difficultés, sachez que vous n'êtes pas seul et que vous pouvez demander de l'aide. Certaines ressources comme l'Espace Mieux-être Canada offrent aux Canadiens de tous âges un accès immédiat et de soutien en matière de santé mentale et de toxicomanie sans frais et de façon confidentielle. Ces services accessibles 24 heures sur 24, 7 jours sur 7, comprennent de l'information, des outils pratiques et des séances confidentielles avec des travailleurs sociaux, des psychologues et d'autres professionnels. L'application Mieux-être, qui sert de complètement gratuit au portail en ligne Espace Mieux-être Canada, constitue un moyen supplémentaire pour les Canadiens d'obtenir des ressources en ligne ainsi que d'évaluer les aspects de leur bien-être et d'en faire le suivi. Les Autochtones peuvent également appeler sans frais la ligne d'écoute d'espoir pour le mieux-être. La COVID-19 continue de nous donner du fil à retordre. Elle nous touche tout différemment selon notre situation. Continuons de faire notre possible pour nous aider les uns les autres à mesure que nous allons de l'avant. Merci. Thank you. Miigwech.
Bon, merci. Normalement, on passerait aux questions, mais je pense qu'il y a un problème technique. Je ne suis pas en mesure de donner la parole aux participants. Je vais quand même essayer, là. Olivier Ferron-Boissé, est-ce que vous serez capable de poser votre question?
Est-ce que vous m'entendez?
Oui, on vous entend. OK.
Génial. Donc, ma question est pour Dr. Njoo. Le Québec va annoncer la semaine prochaine qu'une 4e dose va être offerte à une certaine tranche de la population. Je veux savoir ce que vous en pensez et si vous allez publier une recommandation sur une 4e dose dans les prochaines semaines.
Merci pour la question. Je sais que le Comité consultatif national de l'immunisation est toujours en train d'analyser les données probantes et je pense est en train de peut-être analyser la nécessité de peut-être une autre dose additionnelle, une autre dose de rappel. Mais je ne peux pas prononcer pour le Québec. Je pense que les autorités de Québec a eu peut-être les recommandations de leurs propres experts. Je pense qu'il y a aussi un comité au Québec, aussi un comité d'experts et je pense qu'ils ont peut-être fourni les recommandations au gouvernement de Québec, mais je pense qu'à l'échelle nationale, notre comité continue à évaluer les données probantes et je pense qu'à un bon moment, on va prononcer peut-être sur l'enjeu de notre dose.
OK, donc possiblement qu'on va s'y pencher dans les prochaines semaines et on verra pour une recommandation là-dessus. Mais j'aimerais peut-être plus largement, vous pensez quoi, vous, de cette stratégie-là d'y aller à coup de dose de rappel après plusieurs mois à chaque vague qui revient? Est-ce que c'est viable dans le temps? Est-ce que c'est une stratégie qui peut fonctionner ou on risque justement là, de plus voir le bout à un certain point?
C'est une bonne question et c'est aussi une question, je pense, complexe parce qu'il y a beaucoup de considérations. Je pense qu'ici au Canada, on a bien fait parce que avec le calendrier, aussi avec les données probantes et l'expérience au Canada, on sait maintenant qu'on a bien profité, je pense, on peut dire ici au Canada, avec le calendrier, aussi avec les doses mixtes des vaccins, mais aussi avec l'intervalle entre les doses. Maintenant, la recommandation de notre comité de l'immunisation, c'est un intervalle entre les 2 doses d'une série primaire. C'est mieux d'être au moins 8 semaines et aussi pour une 3e dose, c'est 6 mois après la série primaire. Et je pense que ça donne, une réponse immune plus robuste et durable. Donc, ça fait partie des considérations pour peut-être les futures doses de rappel additionnelles. Mais c'est sûr, ça continue à évoluer la pandémie aussi, comme l'apparition peut-être des autres variants. Donc, je pense que les fabricants, les manufacturiers des vaccins aussi avec les experts continuent à analyser la situation et peut-être aussi avec la science continuer à regarder peut-être est-ce que la formulation des vaccins peut-être doivent changer au futur. Il y a beaucoup de questions, les enjeux comme dit actuels que les scientifiques continuent à analyser. Donc, je ne peux pas vous dire exactement maintenant qu'est-ce qui va se passer au futur pour les doses additionnelles. Peut-être on va trouver même un rythme d'avoir les doses d'un vaccin de COVID-19 à un rythme régulier, mais je ne peux pas dire exactement c'est quoi le calendrier.
Next up, David Thurton, CBC.
Hi. What advice, doctors, are you giving to the federal government about vaccine mandates when it comes to air and rail travel and when it comes to federal workplaces?
I think our role is simply to provide the scientific information about the effectiveness of vaccines, for example. And so it is up to the employer and Treasury Board to make those decisions. So I think that's the advice from our perspective is a technical one. So I know that those policies are under evaluation or review, including, for example, the federal mandates for the federal workers. And so I think you should certainly follow up with Treasury Board.
And so what is the science telling you? Because I think most Canadians can relate to knowing someone who's been triple vaxxed and they've gotten COVID. That's anecdotal, of course. That's not a scientific analysis, but tell us, maybe if you can't tell us what your recommendation is, what does the science tell you about vaccine mandates at this point and how useful they are?
Yes, I think as everyone appreciates, the knowledge about vaccinations evolve over time. And I think with what's been the game changer, I think, is the Omicron variant, which is a vaccine escape variant to a certain extent. The good news, of course, as everybody appreciate, is that the vaccine after 2 doses is really pretty good at protecting against severe outcomes. And after a third dose or an additional dose, that protection against severe outcome is augmented. What is really being looked at is the impact of the vaccination against transmission and infection and also transmission. What we know is that with the Omicron virus, having 2 doses, particularly after a short period of time, the protection against infection and potentially further transmission goes really low. And you would then need the third dose to provide some augmentation of the protection against transmission and infection. And that also diminishes over time. So all of that should be taken into account as the employer or the federal government looks at the policies going forwards. At the same time, I think on things like transportation, et cetera, any layers of protection to provide to protect the traveling public and to protect each other, I think is always a good idea, whether they are mandated or not. And so I think that's, from a public health perspective, we're recommending what I would call vaccine plus other layers for now, because we're in a period of uncertainty where the virus is still undergoing evolution. So getting up to date with vaccines plus wearing a mask is still a really good idea. Just do that for now, especially if you're at high risk. And so I think within the construct of, say, a transport corridor or a workplace, those are the sort of things that people need to bear in mind as they make those policies.
Did you ask your follow-up, David? I'm sorry, I think I lost track.
No, yes, thank you so much.
Émilie Bergeron, la presse canadienne.
Oui, bonjour. Ma question est au sujet du port du masque. Les provinces semblent avoir des approches différentes. Là. Certaines annoncent déjà une date ferme, d'autres annoncent une date visée ou laissent circuler une date probable, d'autres ne se risquent pas du tout. Est-ce que le fédéral est en train de préparer des nouvelles lignes directrices concernant le port du masque? Et quand est-ce que ça pourrait survenir? Là? Est-ce que c'est déjà en cours de préparation, par exemple?
C'est Dr. Njoo. Merci pour la question. Oui, c'est une bonne question parce que oui, on est au courant. On sait que dans toutes les provinces et territoires, peut-être la politique est en train d'être changée. Mais comme Dr. Tam et moi, on a déjà constaté à plusieurs reprises, le port d'une masque bien conçu et bien ajusté, c'est une autre mesure de protection individuelle très importante à éprouver. Et je pense, même s'il n'y a pas, comme dit, un mandat et une exigence, je pense que c'est encore une bonne idée, certainement dans certains contextes, comme je pense que j'ai répondu hier à un autre point de presse, que si on est dans un avion, par exemple, c'est un espace clos, peut-être on est là pour un bout de temps avec les autres passagers, aussi avec un contact étroit. Je pense que même s'il y a un mandat ou pas un mandat, c'est une bonne idée de continuer à porter un masque pour une protection individuelle. Donc, je pense que le message peut-être est simple. Oui, pour le moment, je pense que c'est une bonne idée parce que la science n'a pas changé. On sait c'est quoi le mode de transmission. On sait que maintenant, le virus, même les Omicron, qui est beaucoup plus transmissible, c'est peu comme la fumée de cigarette. Hein. Tu peux rester dans l'environnement et donc, c'est pourquoi on souligne l'importance de port de masque et aussi la ventilation dans les espaces à l'intérieur. Donc, je pense que c'est pas nécessaire de souligner le point encore une autre fois. Je pense que tout le monde connaît c'est quoi l'état de la science et je pense que c'est même si c'était une décision individuelle, je pense pour moi c'est clair pour moi c'est une bonne idée de continuer à porter le masque si on rentre dans les espaces publics avec les autres personnes.
OK, donc si je comprends bien votre réponse, il n'y aura pas de nouvelle ligne directrice, par exemple, prévue le 21 mars parce qu'en Ontario, ce serait le report du masque selon ce qui est prévu. Donc, il n'y aura pas une publication alignée avec ça, si je peux dire, mais ma relance, c'était plutôt au niveau de l'acceptabilité sociale pour que cette mesure-là fonctionne, où elle va rester obligatoire, par exemple, dans les trains. Est-ce que ce sera plus difficile pour des médecins comme vous là, d'articuler ce message-là et de bien faire comprendre à la population quand, par exemple, ils se rendent au restaurant, ce ne sera plus obligatoire ou quand ils se rendent... Comment allez-vous ajuster votre message et est-ce que vous craignez que ça complique votre tâche?
Non, pour moi, je pense que c'est pas très compliqué parce que moi, je pense que oui, c'est quelque chose, une bonne mesure de protection individuelle. Mais je pense aussi, on a déjà avec notre allocution aujourd'hui, on a dit c'est aussi pour la considération et aussi la protection des autres parce qu'il y a beaucoup de personnes peut-être immunodéprimées avec des autres conditions qui sont plus à risque, pas seulement pour l'exposition, mais aussi pour avoir peut-être les conséquences plus graves. Donc, je pense que les Canadiens, on a bien démontré, on est toujours là pour supporter, aider les uns les autres. Donc, je pense que si on prend une décision pour porter un masque, c'est pas nécessairement seulement pour lui-même, pour se protéger, mais aussi une considération pour protéger les autres. Donc, je pense que oui, c'est peut-être compliqué pour les gens. Regardez, c'est quoi les mandats. Ça, c'est comme une exigence obligatoire, mais à part de ça, on a toujours le droit de prendre notre propre décision. Je pense qu'on est toujours prêt à supporter une décision, même personnelle, pour continuer de porter une masque parce que c'est bon pour la protection d'une personne, mais aussi pour considérer la protection des autres.
Dylan Robertson, Winnipeg Free Press.
Hi there. Dr. Tam, I'd like to ask you a little bit about surveillance going forward. Dr. Njoo kindly spoke to this yesterday, but I wanted to get your anything new from you as well about what sorts of talks you're having with the medical officers of health from the provinces in terms of what type of reporting you're expecting going forward, how much of this might resemble flu watch, and if you have any sort of timeline on shifting from, this mode to something permanent that's a little bit perhaps more scaled back.
Yeah, thank you for that question. And it is a topic of very live discussion at this point. Partly, all the provinces are trying to adjust to look at what, frequency of reporting, for example, that they're doing. But for sure, this virus is undergoing evolution. It's here to stay. So there should be an ongoing, sustained surveillance program. And as you said, some of it will be built upon existing programming and infrastructure like FluWatch. So one might expect that on top of any resurgences and new variants, we're going to be building upon a system of regular reporting over the year, maybe escalating in the respiratory virus season. and in conjunction with all the other respiratory viruses, because really you can't tell in terms of the symptoms sometimes what you have, is that they must be more integrated from lab testing to reporting and transmitting the information to the general public. So I think, building all of that towards the fall winter season is very important. But we have to have the flexibility to escalate testing, to escalate sequencing, to escalate the actual reporting as needed if a variant of concern emerges as well. So preparedness to how we do that is really important. And even rapid tests, if you were to use them more strategically, you wouldn't use it at a time period perhaps when the virus circulation is low, but you would then escalate that should we experience a heightened level of activity. We are, as Dr. Njoo probably indicated yesterday, we have built some really great infrastructure over the last 2 years. And so that's actually an enhancement on anything that we've ever had for influenza, which is great news. So the genomics platforms have been greatly enhanced. And we will continue to do genomic analysis and make sure as much as possible our sampling frame of which viruses get sequenced is robust going forwards, including from travelers, for example, and immunocompromised individuals where these viruses could mutate. So these sampling elements are being put in place. Wastewater surveillance, I think, has been mentioned as well. Right now, we have about 60% coverage of the population from some type of wastewater testing program. We need to not let that slip. We need to actually enhance that. And I believe Dr. Njoo also mentioned that we wanted to increase that to 80% coverage, which in a country as vast as Canada with remote communities, it's not actually that simple compared to other countries. And looking at watersheds and how we best capture data from wastewater has been a tremendous lift by many people. So we will continue to strengthen that as well. And we think that will hold great promise as an ability, the device going forward to inform Canadians about the activity within their communities. And so we'll continue. Right now, we are certainly continuing the mandatory random testing for arrival travelers, again, as a surveillance program to detect variants of concern. So I hope that answers your question. And of course, on top of regular case reporting from provinces, we have sentinel hospital networks that can give us a really good sense of trends in terms of the severity indicators. And we're working with provinces on the issue. I would say this is a long-standing issue of reporting mortality as well in more real time. We've had some gains during this pandemic, but we need to be able to solidify those gains.
It's
Thank you.
It's Dr.
Go
Njoo.
ahead.
Yeah, the other point I would make, it's interesting that maybe it's kind of overlooked is I think we have a very strong, surveillance overall with many components for vaccines and vaccination. And that's going to be very important moving forward as well, right? Obviously, the data we have in terms of vaccine coverage, even for certain, age groups and so on, certainly helps us and helps NACI in terms of developing the recommendations. Obviously, it's very important as we continue to roll out vaccines to monitor for, adverse events, and that helps us in terms of what we need to do in terms of moving forward with our vaccine rollout. And of course, the fact is that, with the vaccination as well, we can look at effectiveness. So if you do get cases, in terms of breakthrough infections, transmissibility and so on, that's all part of it. So it's not just about the reporting on the cases, but, were those cases vaccinated or not? I think it's going to be very important, especially in the COVID-19 context as we move forward.
Thank you. And as a follow-up, I just wanted to ask about FACT's role when it comes to the federal jurisdiction and some of the restrictions around masking, around vaccine passports. I know it's a very broad question. It gets into workplace policies. But right now, we do have a patchwork in Canada where people go into a Service Canada office. There's a mask requirement. They go to a federal museum. It's a little bit different from what their province is saying. I'm just wondering what FACT's role is in informing those discussions, where those discussions stand right now, if it's being actively looked at lifting some of those, masking and vaccination requirements for public-facing federal institutions.
Yes, I think I did just answer that question, and maybe it wasn't. It didn't quite hit the spot for you, but yeah, I think the employer, the Treasury Board, actively examine all these policies, and our job is really to provide them with the data that we have in terms of vaccines, vaccine effectiveness, both against transmission, infection, and against severe outcomes, and together with other considerations, but I think the federal government has taken a very precautionary approach, very thoughtful approach, and is looking at the phased approach of removing some of these policies. And there will be, I think, individuals who will, such as people who have immunocompromised conditions and other underlying factors that make them more concerned about a workplace if there wasn't some of these measures in place. So I think there'll be a lot of discussions between the employer and the unions and others as well on this matter. But I know that these policies are being reviewed and re-examined as we speak.
Valérie Gamache, Radio-Canada.
Oui, bonjour, Dr. Njoo. J'ai une première question sur ceux qui ont eu Omicron. On disait que ceux qui avaient eu Omicron n'avaient pas besoin de 3e dose de vaccin à court terme. Est-ce qu'avec le BA2, c'est différent? Donc, est-ce que ceux qui ont eu Omicron sont aussi protégés contre le BA2?
OK, merci pour la question. La réponse simple, c'est si on a eu déjà une infection avec Omicron, peut-être le BA1, ça se protège aussi contre l'autre variant, le BA2. C'est avec les données probantes à date. Mais peut-être l'autre question avec une 3e dose, c'est une infection antérieure. Moi, je pense qu'il y a un aspect scientifique, mais aussi, un aspect, administratif, parce que c'est sûr avec 2 doses, une série primaire et même une dose de rappel, ça donne un bon niveau de protection. Mais on peut considérer si on a eu une infection, c'est un peu comme semblable à une dose de vaccin. Mais pour les objectifs administratifs, je sais qu'il y a comme une exigence peut-être pas démontrée pour plusieurs raisons. Il faut fournir preuve d'avoir comme 2 doses, avoir une série primaire. Donc, ça, c'est quelque chose qu'on continue à évaluer avec les données probantes. Mais je pense que je veux souligner le point que une infection, c'est aussi, ça peut aussi stimuler le système immunitaire, peut donner une certaine protection, mais on sait, même si c'est une infection, comme on dit, avec le virus ou une dose d'un vaccin, et aussi une diminution d'immunité avec le temps. Donc, c'est toujours important de continuer à évaluer l'importance peut-être d'avoir peut-être une dose de rappel après un bout de temps. Mais pour la question pour le BA2, oui, si on a déjà eu infection BA1, ça se donne une protection contre le BA2.
Et puis, mon autre question concernant les masques, vous avez dit que vous recommandez le port du masque même dans les cas où les autorités locales ne l'exigent pas. Est-ce que c'est donc dire que les provinces comme l'Ontario et le Québec agissent pas de façon responsable en levant cette mesure-là? Et à tout le moins, est-ce que ça n'envoie pas un message confus?
Non, je pense que c'est dans peut-être une transition, une phase de transition. Je pense que au début, avec les autres vagues, peut-être plus important avec les mesures de santé publique, d'avoir peut-être les mandats pour vraiment renforcer le point, et aussi parce qu'on a eu l'impact vraiment avec les hospitalisations, tout ça, que c'était vraiment, comme dit, le système de soins de santé est vraiment poussé jusqu'à la limite. Maintenant, on est pas mal, je pense, dans une meilleure situation avec la situation épidémiologique. Et je pense que tout le monde sait peut-être que c'est quelque chose comme une évaluation de risques individuels aussi pour prendre des décisions. Je pense que les gouvernements à travers le pays essaient de trouver un équilibre entre qu'est-ce qu'il faut, comme dit, obliger la population et aussi peut-être qu'est-ce qu'on peut faire comme les individus pour prendre les bonnes décisions pour gérer le risque. Et je pense que c'est sûr, peut-être au futur, on ne sait jamais avec une autre vague, peut-être avec une autre variante, peut-être qu'il faut s'adapter, aussi peut-être changer les mesures de santé publique. Mais pour le moment, je pense que tout le monde comprend que oui, c'est trouver un équilibre pour les gouvernements, pour les mandats, et aussi pour, comme dit, les décisions à l'échelle personnelle.
Laura Osman, Canadian Press.
Good morning, doctors. It's Laura Osman from the Canadian Press. I wanted to ask you about these cases that we're seeing going up abroad that the WHO is warning about. You also, of course, mentioned the potential for an increase in cases here in Canada as public health measures are lifted. There seems to be less concern about this potential bump in cases this time around. I'm wondering if you can sort of put it into context, given that we are expecting to see potentially another increase.
Yes, so globally, I think all we can say is this virus is in wide circulation and continues to be so. Globally, most of what's circulating are Omicron and their sublineages. And we're seeing BA2 increasing globally. And in particular, some of the Asian countries. And there is also a smaller uptick in some European countries at the moment. So I think in some of the global epidemiology, what you're seeing in particular, very important lessons. One is that vaccines are very important, so particularly for the high risk. For an area like Hong Kong, where they've tried to minimize the cases all the way through the last couple of years, but during that period hadn't vaccinated the high risk, or the uptake hasn't been optimal, you have a very high mortality. Somewhere like New Zealand, which also tried to keep out cases as low as possible, has had a great vaccination campaign, and we're not seeing that kind of severe outcome, which comes back down to Canada. We have had a very successful vaccine campaign. There could still be improvements. I think everyone who hasn't been vaccinated with a primary series hasn't been boosted when the boosters are recommended for you, especially the 50 plus, go get it now. I think it's still very relevant messaging for Canadians, because all that was going to do is try and prevent the escalation in hospitalizations and keep that under manageable levels. And we can still do that. Even if there's a spring blip, we're seeing some of that going on in the United Kingdom and European countries. It may well happen to us, but to keep it manageable, get vaccinated. Back to that question about mask, I think a more common message, not to confuse the general public, is that keep the layer of masking as much as possible. Yes, it is a personal decision at this point when mandates are being removed, which is a difficult period of adjustment. But I would say, given the possibility of the uptick in cases, it's prudent to just wear a mask for now. So vaccine plus mask. And that will stand us in good stead as we're moving ahead in the next weeks, while we're monitoring, of course, Europe, which is a little bit ahead of us, very carefully. And then when you're traveling, of course, layer on the protection, especially in a country where the virus might be extremely active. But I think the vaccines clearly are protecting people against severe outcomes. And so that's, I think, what collectively in the Canadian health system we are resting on. But we must still sort of manage it quite carefully. I don't know if that answers your question, but BA2 is definitely proportionately rising. It is more transmissible. What it will do is seek out pockets of the population where the immunization rates are lower, where people haven't been boosted, and where there hasn't been a lot of BA1 or 1.1. Those are the at-risk populations.
Thanks, Dr. Tam. And it sounds like through this transition phase, we're moving away from being terribly concerned about the number of cases and rather focusing on the outcomes. So to Dylan's point about surveillance, is that what we're going to be focusing on? Is the number of cases becoming less relevant now that we're moving into this transition phase and more people are vaccinated?
I think that in many senses correct, but you still need to have good surveillance that is geographically representational and still allows us to monitor trends and signals. So it is still important to carry on with testing and looking at those trends at the same time as, of course, monitoring hospitalizations and severe outcomes. That is a must that we must continue. But things like wastewater signals, but also through covered, thought about sampling frames for surveillance purposes is still important. And that needs to be worked out and strengthened with the province and territories as we're going along. And then there's the sequencing, of course. But you're right in that, we're not counting every case, and we have never really ever done that because there's always the tip of the iceberg. And right now that is definitely not happening. There's a lot more cases out there than has been counted. We know that. But right now is more about surveillance as a signal detection and trend analysis. And we will be keeping a much closer eye on the actual rates of hospitalizations and more severe outcomes.
So I don't see any hands up, but we still have time for questions. Anyone wants to have another question? Just let me know. Okay, Laura, go ahead.
Hi, doctors. Just to sneak one more question in. Dr. Tam, you were talking about what you're expecting given this rise internationally. I just want to be clear, are we expecting our hospitalizations to remain low given the situation that Canada is in this spring?
I think based on modeling and based on what the provinces are reporting, hospitalizations could certainly come up when cases go up. However, it is expected that increase in hospitalization would be less than what we just saw. And we were at some limits of the abilities of the healthcare system to cope with the Omicron wave just because of sheer volumes of cases. But going forwards, based on what I have seen from provincial analysis, that they're expecting the hospitalizations to be manageable. But I think we do have to watch that really carefully. And that's why we ask people to get vaccinated so that the serious outcomes can be prevented.
Thank you.
Thank you. Kevin Gallagher, CTV News.
There we go. I'm unmuted. Sorry about that. Thanks. This question is for Dr. Tam. You've talked a lot about the importance of getting a third shot or a booster shot. But at the same time, we just had, the testing at the border limited for people other than those who are fully vaccinated. However, that definition of fully vaccinated still is just 2 shots. Is it time that the federal government, is that going to be advice that you give to the federal government to change the definition of a full series or fully vaccinated to those with booster shots? And would that affect people who are currently, need to be fully vaccinated to get on a plane or a train in Canada, and also if they're going to get past testing requirements at the border? Thank you.
Yeah, so the definition of fully vaccinated for the purposes of border measures is still staying at the primary series, the 2-dose at the moment. It's actually a very difficult question because the recommendations for the booster shot, and we do think that 3 doses are important. And I think that should be clearly stated. But the timing of the booster dose is such that it might be quite different for different groups of people. So I think the recommendations for different age groups could be slightly different. And then you have to think about people who've also had an infection, and they then need to ideally wait a number of weeks and maybe 3 months before they get the booster shot. So it becomes a very complicated algorithm, if you like, to work out. And the rest of the world, not only have they not had access to boosters, many countries haven't, in fact, had even 2 doses. So all of this has to be borne in mind when the government makes their policy decisions. So it's not easy, and you have to make it relatively simple for travelers. So all of that has to be taken in mind. So at this moment in time, it's staying at the primary series of 2 doses. If there comes a time where a very severe variant is coming up and we know it's spreading, then border measures can always be re-examined from that perspective as well. So having the infrastructure, having the ArriveCAN, having the ability to upload vaccine information continues to be important in the event that we may recommend a booster being added. But for now, I think we're staying where we are. As Dr. Njoo and others have mentioned, public health is a very important juncture where we're shifting the emphasis from requirements to recommendations. And so even this policy has to be examined in that light. But because one of our key objectives is to reduce the impact on the Canadian health system, 2 doses of vaccine, better if you get 3, will reduce the severe outcomes. So all of these things are taken into account as we currently hold our ground right now, but be ready to shift as needed.
So I take it then that under the current circumstances, even given the new Omicron subvariant, that where's your evaluation domestically then in terms of using vaccine mandates for a booster shot to encourage more Canadians to get that 3rd shot? And I'm wondering too, I hate to double barrel questions, but I'm going to break my own policy here. Adding on to that, is there an idea that you have right now where I think less than around 50% of Canadians have gotten that shot? If it's under 18, like all Canadians, it's below half have gotten that booster shot. Is there a goal in mind that PHAC has for how many Canadians need to get that 3rd shot in terms of having the optimal outcomes to keep hospitalization levels and severe outcomes at a low level? Or is it, like you mentioned, an age thing? I'm interested to see if you have a sort of a benchmark that you're looking at when it comes to a 3rd shot in terms of managing the pandemic going forward.
Well, I think, obviously as many people as possible for those who are eligible to get the booster should get it. But some of the complexity with that comes with, as you've just mentioned, the differential risk of severe outcomes through different age groups. The differential risk, if you had 2 doses of vaccine and then you have Omicron and then you get another dose, and the timing of those. But I would say that what is important, so amongst all adults, so over 18 years of age, 56% have had the additional dose. And among those, fully vaccinated at the moment, 62% of them have had that booster. So it is still going up, and we would like it to go higher. But what is actually important is the seniors, the 80 plus, the 70 plus, for example, have actually had very high boosted dose coverage, which is the most important thing. I would say that there's a gap for the 50 plus. If you haven't got your boosters, go get it for personal protection. And that would, I think still be very relevant given the potential for an uptick as the public health measures are eased. I don't think we can just set a benchmark target except to, get the rates up as high as possible. How you get those rates up, I think, is what you're asking about in the role of mandates. And as you've seen across the country right now, the public health strategy is moving away from mandates to recommendations and to use all manner of other means to increase coverage for the boosters in terms of many different strategies to reach the under-immunized, engaging local and community leaders, using very different differential access measures to get that booster dose up. And so I think there's just a general trend of moving away from mandating to recommendations and making more and more effort to have that recommendation. As we move away from the spring and the potential, monitoring that upsurge carefully in the next weeks, then we're looking towards preparedness for a variant concern that pops up, but also for the fall. So if booster rates are not high enough leading up to the fall, one of the first things we would look at in our options for the strategy moving into the fall is to make sure people do get the boosters. On top of that, there's also the questions of the 4th dose, et cetera, that will be examined as well. But I think that's where the policies are across the country. And the federal government will sort of examine the policies related to the federal mandate, which I've just mentioned. But I don't think that the general trend is to use vaccine mandates to incentivize that 3rd dose. We want Canadians to want to get it because it makes sense from a protection from serious outcome perspective. There are high-risk places, though, where some of these requirements might be maintained, like long-term care homes and other high-risk settings.
Alors, c'est ce qui met fin à la conférence de presse. Thank you, doctors. Thanks, everyone. Have a good weekend.
Recording stopped.